Hi, my name is Claudia. I'm the infection control nurse for the Trust. On this short video, I aim to demonstrate the process of collecting a nose and throat sample for COVID-19. This will include information about 1. Who to swab and when. 2. Completion of the pathology form and sample bottle. 3. How to collect a sample, including the process for putting on and removing PPE, and correctly packaging the sample for transport. Who should be tested and when? In line with national guidance, all patients newly admitted to hospital should be tested for COVID-19. Ideally, we should carry out the test as early as possible once a decision to admit has been made. This is important to reduce the level of infection and ensure that patients are provided with the best care in the right environment. This can be carried out in a variety of settings, including the community, the patient's own home, and A&E. This should not delay admission. If it's not possible to carry out the test prior to admission, this can be done on the ward as early as possible. In addition to newly admitted patients, we will continue to test those patients already under our care with suspected COVID-19 infection. Of course, patient consent is required in all cases. Fill in the pathology form and the sample bottle. The first step is to complete the pathology form and the sample bottle. This is very important in order to ensure that the results are reported. Failure to correctly complete all fields might result in the sample not being processed. These include full name, date of birth, trust ID, gender. When testing staff, the data required is slightly different. More detailed information, including sample forms, is available in the written guidance, which is posted on Node. Putting on PPE. Before you start the process, make sure you have all the required PPE in your clean surface. This will include white apron, fluid-resistant surgical mask, eye protection, and clinical gloves. The next step is to carry out hand hygiene, either with soap and water or alcohol gel. Remember, clean hands, safe hands. And then I will demonstrate how to put on the PPE in the following order. First step, alcohol gel. Clean your hands thoroughly with alcohol gel. Wipe your hands. Then, white apron. And secure it in the back. Make sure it's secure. And here is a tip. You can keep the eye protection and the same surgical mask when swabbing several patients. However, apron and gloves need to be changed after each patient. Then you put on surgical mask and you make sure that molds into your nose and it covers the chin, and you will select which eye protection you would like to wear. We strongly recommend that you wear eye protection when taking a sample, either a face shield or eye goggles. And then you're done.
So when you're ready to take a sample, you will need a swab, which will come with a tube. So the area that you will swab will be the back of the throat and the arch of the tonsils. That's a very sensitive area, and most people will feel a gag reflex. So I strongly recommend that you wear eye goggles or face shield, since you will be close to the patient within 1 meter and then risk of respiratory droplets. This is very easy to do and it doesn't take very long. Also, you can see that the hand doesn't touch the mouth and it's a circular motion. So please make sure you swab the back of the tonsils by the arch. Once you do that, you use the same swab and take a sample from one of the nostrils. You go as far as you can until you feel resistance, and you will rotate the swab gently. In the moment that you feel resistance, you will stop. So you're looking for the surface antigen, the RNA, in the back of the throat and in the back of the nose. And one nostril will suffice, and it's according to Public Health England guidance.
One, go.
Okay, so now I'm ready to take a sample, and Debbie is going to play the role of a patient. So make sure you have your swab ready, and you will see that the swab is quite long. Make sure you have your tray. Yep. Open the tube and have it ready, and then explain to Debbie, your patient, what you're going to do next. Hi Debbie, I'm going to take a sample for COVID-19. Okay, and I'm going to swab the back of the throat. You might feel a reflex that might want to make you gag. It doesn't hurt, and you might feel like you want to cough. Okay, but it won't take very long. Are you ready?
Yes.
Okay, if you open your mouth wide, okay, and just we do one side, and then we do the other side. Very good. So now we're going to take a sample from the back of your nose. Okay. This doesn't hurt, okay? I will rotate the sample and go as far as I can go, okay? But without giving you any pain. You might feel like you want to sneeze, and that's okay.
Okay.
Rotating. And then the moment that you feel resistance, you stop. That's it, that's done. That's all done. Thank you. You put the swab inside and you break in half. Okay, and then you place it in your form. You will see that you have a pocket here, and you will seal it.
Claudia is now going to demonstrate removal of PPE. It is important to remove PPE in the correct order. That order is first gloves, then apron, then eye protection, and then surgical mask. Okay. In order to remove gloves, you grasp the outside of the glove and you peel away from the hand. You do the same with the second glove, peel away from the inside, encapsulating the first glove within. Then we dispose of as clinical waste. In order to remove the apron, you unfasten or break the clasp at the back, and fold it onto itself, avoiding touching the outside of the apron. Then you undo the back, and again fold it in itself into a bundle, again dispose of as clinical waste. Then remove the eye protection as demonstrated, and then remove the surgical face mask. You need to avoid touching the front of the mask, so as Claudia is demonstrating, it's removed by handling the bands that go around the ears. We then dispose of as clinical waste.
Here's a tip. You can keep the same surgical mask and eye protection after you see each patient. However, gloves and aprons need to be changed after each patient. And then you're done. Once you have taken the sample, place it inside the bio container, seal it. You will see that has a sticker with the name of the trust. Place it inside the cardboard box, close it, strong and secure. Use alcohol gel before you place the sample inside the BioPad transportation bag. So this is the BioPad bag. It will give you choice for hospitals. Select King's College Hospital. Place the sample inside the bag. Remove the silver seal. Seal it, and you can add the location where the sample is coming from, and then your sample is ready to go, and you can decontaminate surfaces, and then you're done.